So the first topic we'll be looking at in the pharmacology is influence of age, the types of food you eat, and the types of disease condition you have on the effectiveness of drugs. Do you understand? So how old you are can affect how much very effective a drug will be in your body, how fast the drug will be put out from your body. The type of food you eat could either slow down the actions of a drug or increase the actions of a drug. Do you understand? There are some drugs that they'll say take it on an empty stomach. There are some drugs that they now say eat food before you take it. Then also, disease conditions you have can actually affect how a drug will function. Do you understand? So let's quickly look at these aspects, okay? So how these things actually affect the effectiveness of a drug. So first, looking at the influence of age. In pediatric patients, those are like children, newborns, adolescents, most of them, they have immature liver and kidneys. So you could see that the dosing for a drug will be reduced because you don't want that drug to damage the liver or kidneys. And you know that generally the metabolism will be slow. Okay, so the rate at which the drug will be put out from the system will be slow. Low plasma protein levels alter the way drug will be binding and be transported. High body water content. Okay, so do you understand? So for example, drugs are, if they are dosed the same way you dose it in adults, they could now cause a lot of side effects. Like for example, you say chloramphenicol can easily cause a great baby syndrome in a newborn. Then for elderly patients, we are not talking about adults. Adults, they have everything functioning optimally, but for the elderly class, you know that the kidney functions and the liver functions are tilting down. There's altered body composition, there's increased fat. That's why I see a lot of our elderly ones, they are large and all of that, you understand? Then polypharmacology risk. So most of them, they are on different drugs, diabetic drugs, antihypertensive drugs, you understand? So sometimes if you now give them any drug, you could just have some drugs reacting together in their system. So what's the influence of diet on food? So sometimes there's food-drug interaction, and this food-drug interaction can actually alter how a drug is being absorbed. It can alter how a drug is being metabolized. It can alter how a drug is being excreted from the system. Okay. So high-fat meals may enhance absorption of lipophilic drug. Calcium-rich foods can chelate tetracycline. It will reduce the absorption of all the tetracyclines, clot tetracycline, a lot of them. Okay. Grapefruit juice increase the levels of drugs like statins. Protein-rich diets may affect drug metabolism enzymes. So what's the influence of disease on how a drug will be effective? Of course, a drug is usually being broken down in the liver. So if you have underlying liver disease, it will decrease the metabolism of this drug and have a lot of the drug being piled up in your system, and this could actually result into toxicity. So for kidney disease too, when the drug is broken down, it's put out through the kidneys. Most of it is renal route, some is fecal route, while some is bile, but most of the drugs are renal routes. So if your kidneys already have an underlying issue, it will actually decrease how much of this drug is put out from your system. So you have accumulation of drugs too. So GIT disorders, if you have all those malabsorption syndromes, diarrhea, could actually reduce the amount of drug that is actually getting into the system. Endocrine disorders, if your hormone levels are not balanced, it can also affect how drugs are being absorbed in your body and all of that. Okay, so basically that's it. That's how age, the type of food you eat, and the disease conditions you have could actually affect the effectiveness